Hello, my name is Elena and I am your Substance Abuse Wellness Facilitator. Today we'll be taking a quick look at COVID-19. Let's get started. COVID-19 is a disease caused by a coronavirus, a common virus that can cause what doctors call a respiratory tract infection. It can affect your upper respiratory tract, sinuses, nose, and throat, or lower respiratory tract, windpipe, and lungs. In early 2020, the World Health Organization identified a new type of coronavirus. This is the virus that causes COVID-19. The outbreak has quickly spread around the world. It spreads the same way other coronaviruses do, through person-to-person contact. Infections range from mild to serious. The main symptoms, fever, cough, and shortness of breath. Early symptoms are much like those of the common cold, but the virus can lead to pneumonia, respiratory failure, and in some cases, septic shock. If you're exposed and infected, symptoms can show up in as few as 2 days or as many as 14. It varies from person to person. When you have symptoms, they can be similar to a bad cold or the flu. COVID-19 will be considered if you have fever and breathing problems and you've traveled to places where the virus has spread. You've been exposed to people who have it within the last 14 days. COVID-19 mainly spreads from person to person. Most of the time it spreads when a sick person coughs or sneezes. They can spray droplets as far as 6 feet away. If you breathe them in or swallow them, the virus can get into your body. Some people have spread the new virus without being sick, but that's less common. You can also get the virus from touching a surface or object the virus is on, then touching your mouth, nose, or possibly your eyes. The number of people infected by COVID-19 changes every day. If you're in an area where it's spreading, take these steps. Wash your hands often or clean them with an alcohol-based sanitizer. This kills viruses on your hands. Keep your distance. Stay at least 6 feet away from anyone who's coughing or sneezing. Don't touch your face. Coronaviruses can live on surfaces you touch for up to a few hours. This includes metal for 8 hours, copper for 4, wood, cardboard for 24 hours, and plastic for almost 48 hours. If they can get on your hands and get to your eyes, nose, or mouth, they can get into your body. There's no need to wear a face mask unless your doctor tells you to. You will need one if you've been exposed to COVID-19 or caring for someone who has it. There's no specific treatment for COVID-19. People who get it need care to ease their symptoms like rest, fluids, and fever control. Those with severe cases need to be cared for in the hospital. Anyone can get it, and most infections are usually mild, especially in children and young adults. But if you aren't in an area where COVID-19 is spreading, haven't traveled from an area where it's spreading, and haven't been in contact with someone who has it, your risk of infection is low. Older people and those with weakened immune systems or medical conditions like chronic bronchitis, emphysema, high blood pressure, heart disease, lung disease, cancer, or diabetes are most likely to get a serious illness. If you live in or have traveled to an area where COVID-19 is spreading, if you don't feel well, stay home. Even if you have mild symptoms like a headache or runny nose, stay in until you're better. This lets doctors focus on people who are more seriously ill and protects healthcare workers and people you might meet along the way. Call the doctor if you have a fever, cough, and trouble breathing. You need to get medical help as soon as possible. Calling ahead rather than showing up will let your doctor direct you to the proper place, which may not be your doctor's office. If you don't have a regular doctor, call your local board of health. They can tell you where to go for testing and treatment. Follow your doctor's advice and keep up with news on COVID-19. Between your doctor and healthcare authorities, you'll get the care you need and information on how to prevent the virus from spreading. Thank you so much for watching this lesson. I am Elena, and if you would like to learn more, please visit sawtoolbox.com.